Illinois' rendezvous with reality. Governor Pat Quinn released his proposed budget today, complete with massive closures and cuts, including $2.7 billion to Medicaid funding. During his budget address in Springfield, Governor Quinn says that Illinois must reconsider the groups eligible for Medicaid, the services it provides, how those services are used, and how to pay for them. And he says the state must protect against fraud and abuse.
We must navigate our budget out of the past decades of poor fiscal management and deferring bills to the future and empty promises. We must achieve fundamental and lasting budget reform, and we must do it now.
Despite last year's income tax increase, the state finished more than $8 billion in the red. Meanwhile, local healthcare providers tonight speaking out about those proposed Medicaid cuts. At Trinity Regional Health System, Medicaid payments are now running some 200 days behind. The state owes the hospital about $16 million. Trinity's president there, Rick Seiler, told News 8 today that Illinois needs to cut spending, but when it comes to Medicaid restructuring, it's too early to tell what effect it could have on services and jobs.
The 18% cut in Medicaid spending is very aggressive, and I know the state's in a very difficult financial situation, but it's going to be devastating for providers and ultimately for patients, I think.
Much more on all this at 10. Seiler says the reform proposal still has miles to go in the legislative process.